Learning about chemotherapy. Hi everybody, do you know what chemotherapy is? Let's start learning right now. Chemotherapy, commonly known as chemo, is short for cytotoxic drug therapy. It uses chemical drugs to stop cancer cells from dividing and growing and ultimately destroying them. It's a type of systemic treatment. Prior to starting chemotherapy, you need to know: what's the goal of treatment? What drugs will be used? How will they be given? What's the schedule like? Will it be combined with other treatments? What side effects might occur? And how to prepare. Chemotherapy is classified into 5 types based on the stage of cancer and treatment goals. Neoadjuvant chemotherapy is given before surgery to make the tumor smaller and improve surgery outcomes. Adjuvant chemotherapy is given after surgery. Its goal is to kill any remaining cancer cells and help prevent the cancer from coming back or spreading. For some cancers, like leukemia or lymphoma, chemotherapy is the main treatment used to cure the disease. In some cases, very high-dose chemo is given to destroy all cancer cells. This is known as curative chemotherapy. For patients whose symptoms are under control, maintenance chemo uses low-dose, low-toxicity drugs over time to slow the growth of any remaining cancer cells. Palliative chemotherapy is used for patients with advanced cancer that has spread. It helps slow cancer growth, ease discomfort, and improve quality of life. To get the best results and reduce side effects, your chemotherapy plan will be based on the type and stage of cancer, the cancer cell type, hormone receptors and gene test results, how treatment may affect your body, and your overall physical condition and treatment goals. Even for patients with the same type of cancer, the treatment drugs, timing, frequency, and where it's given can all be different. Chemotherapy is most commonly given through an IV catheter placed in a vein. To reduce the risk of drug leakage and the discomfort of repeated needle sticks, your doctor may suggest placing a device called an implanted port. There are 2 common types of access devices for chemotherapy. The first type is called Port A cath. It's placed under the skin on the upper chest through a minor surgery and is about the size of a quarter. Since it's completely under the skin, it may appear as a small bump but will not interfere with daily activities. The second type is a PICC line, which is inserted into a vein in the arm. Part of the line stays outside the skin and is used for injections. Before you go home, the nurse will show you how to keep it clean, change the gauze, and avoid damaging the line while moving around. The length of chemo infusions may vary, depending on your condition and the drugs used. Some take just a few hours, others can last for days. Chemo drugs can harm the tissue around the vein. If the drug leaks out, it can cause redness, swelling, skin damage, or even require surgery to remove that tissue. During chemo, if the injection site feels cold, painful, burning, swollen, or if you notice any leakage or discomfort, let your nurse or doctor know right away. Oral chemo drugs often come as pills, capsules, or liquids that you can take at home. However, some drugs need to be taken on an empty stomach, with food, or after a meal. Be sure to follow your doctor's instructions on how much to take, when to take it, and what foods to avoid. If you miss a dose, Consult your doctor or nurse for instructions. There are two ways to deliver chemo into the spinal fluid space. The first method is a direct injection into the spinal canal. The other method involves a small device called an Wire reservoir, placed under the scalp and connected to the cerebrospinal fluid, allowing medication to be injected through it. In some cases, chemo is injected directly into a single artery to treat a specific area, like the head and neck or the liver. This helps reduce damage to the rest of the body. However, intraarterial chemo only works locally, not throughout the whole body. A special tube delivers chemo into the abdominal cavity, where it's absorbed into tiny blood vessels to reach small peritoneal tumors, like those from stomach, colorectal, or gynecologic cancers. Other methods of administration include injection into the pleural space, bladder, muscle, subcutaneous tissue, or direct application onto the skin. We hope this video has helped you better understand chemotherapy, feel more prepared for what lies ahead, and take better care of yourself. If you have any questions before, during, or after treatment, please don't hesitate to ask your medical team. Let's stay strong together. We wish you a smooth recovery and a healthy new beginning. Toll-free advisory hotline 0809 010 580.